Hello everyone, and thank you for watching. Today I'll provide an overview of the 2026 Promoting Interoperability updates, highlighting what you need to know, along with how KONZA Health is supporting our members. Here's a quick look at our agenda. I'll begin with an introduction and overview of KONZA Health. Then we'll review the key 2026 Promoting Interoperability updates, followed by an overview of PI program requirements for both hospitals and eligible clinicians. We'll also highlight how KONZA Health supports these efforts, including certificates available to eligible members, and conclude with relevant resources. I'll start with a quick introduction. My name is Kelsey St. Clair. I'm a registered nurse and clinical informatics training specialist here at KONZA Health. My background is in both clinical care and health informatics, which helps me bridge the gap between technical requirements and real-world workflows. I focus on interoperability, quality programs, and promoting interoperability, and I work closely with hospitals and providers to turn those requirements into practical steps and measurable outcomes they can apply in their day-to-day work. A little background on KONZA Health. We are a private, nonprofit, provider-led organization focused on improving how healthcare data is shared and used. In December of 2023, KONZA Health became one of the first designated qualified health information networks, which allows us to connect and exchange data nationally. We also expand across state lines with 10 HIE partnerships across 10 states. We support one of the nation's largest validated clinical data streams, including 395 NCQA DAV accredited sites for CCD and 262 for FHIR, ensuring the data is validated for use in quality reporting and programs. Security is also a top priority for us. We maintain industry standard accreditations and certifications for protecting healthcare data. Overall, our goal is to support interoperability, advance value-based care, and provide actionable insights to our members. KONZA Health was founded in 2010 as the Kansas Health Information Network, or KHIN, and has grown from a statewide health information exchange into a mission-driven partner with both national reach and local impact. Our mission is to connect healthcare providers, patients, health plans, and technology partners to turn data into meaningful information that drives healthcare transformation. To support that mission, we've built strong partnerships with medical associations and medical societies to develop affiliated health information exchanges across the country. What you're seeing on this map is a reflection of those partnerships and the network we've created to support more connected, interoperable care. Now let's talk about promoting interoperability and take a look at the key changes announced for 2026. So what's changing in 2026? First, the security risk measures have been updated. There are now two separate attestations, one confirming that a security risk analysis was completed, and another confirming that security risk management is being maintained in alignment with HIPAA requirements. There's also an update to the Safer Guides requirement. For 2026, organizations will need to use the updated 2025 Safer Guides when completing their review. Another change is the addition of a new optional public health bonus measure. This allows organizations to earn up to 5 bonus points for public health reporting using TEFCA. CMS has also introduced a measure suppression policy. This means that if a measure is temporarily suppressed, it still needs to be reported, but it will automatically receive full credit. One example of this is electronic case reporting, which is currently suppressed for calendar year 2025 due to CDC onboarding pauses. Even though it's suppressed, organizations still need to report it in order to receive the full points. Otherwise, they would receive 0. Overall, these updates are focused on strengthening security, supporting national exchange through TEFCA, and providing flexibility where there are external limitations. Now that we've covered the key changes, let's walk through an overview of the Promoting Interoperability Programs and the general requirements. First, let's look at who the Promoting Interoperability Program applies to. Overall, the program is designed for both hospitals and clinicians, but they participate through slightly different structures. On the hospital side, this includes eligible hospitals, including acute care hospitals and critical access hospitals that are part of the Inpatient Prospective Payment System, or IPPS. On the clinician side, promoting interoperability applies to eligible clinicians who are participating in the Quality Payment Program, or QPP. This is most commonly through MIPS, the Merit-Based Incentive Payment System, or through certain alternative payment models where promoting interoperability is a required component. So while both groups are working toward similar interoperability goals, the way they report and are measured will vary slightly depending on whether they're a hospital or a clinician. Let's take a closer look at the 2026 Promoting Interoperability requirements specifically for hospitals. The requirements for hospitals participating in promoting interoperability in 2026 include using ONC Certified Health IT. For the reporting period, hospitals can choose any continuous 180-day period within 2026, but that reporting period must begin no later than July 5th. In terms of submission, all data must be submitted through the HQR Secure Portal with a deadline of March 1st, 2027 by 11:59 p.m. Pacific Time. To successfully meet program requirements, hospitals need to earn at least 80 out of 105 possible points. And finally, it's important to keep timing in mind that any payment adjustments tied to 2026 performance will actually be applied in 2028. Now looking at how hospitals are scored, there are 4 main categories. You have electronic prescribing worth 20 points, which includes both e-prescribing and PDMP queries. Health information exchange is the largest category at 30 points, where hospitals can choose how they meet the requirement, whether that's through sending and receiving referral summaries, bidirectional exchange, or participating in TEFCA. Then there's provider-to-patient exchange, worth 25 points, which focuses on giving patients access to their health information. Next is public health and clinical data exchange, also 25 points, which looks at reporting to public health and registries. There's also the optional bonus opportunities, including public health and clinical registry reporting, and using TEFCA for public health, for up to 5 additional bonus points. In addition to the scoring, there are a few required attestations, including completing the SAFER guides and security risk analysis and management activities, along with confirming that you're not restricting interoperability and complying with ONC review requirements. The screenshots shown here are from the calendar year 2026 Medicare Promoting Interoperability Program Requirements infographic from the Quality Reporting Center. They correspond to the requirements we covered on the previous slide, and a direct link to this infographic is included at the end as a reference. Next, we'll review the Promoting Interoperability requirements for eligible clinicians. The requirements for eligible clinicians are very similar to hospitals. Clinicians must use ONC Certified Health IT and report on any continuous 180-day period in 2026, starting no later than July 5th, 2026. Data is submitted through the QPP portal with a deadline of March 31st, 2027, and clinicians must earn at least 75 out of 105 possible points to meet program requirements. Like hospitals, payment adjustments for eligible clinicians are applied 2 years later, starting in 2028. For clinicians, adjustments can be positive, neutral, or negative, with potential penalties up to 9% if the required score isn't met. Looking at how eligible clinicians are scored, the structure is very similar to hospitals. There are 4 main categories: electronic prescribing, health information exchange, provider-to-patient exchange, and public health and clinical data exchange. Health information exchange is still the largest category, where clinicians can choose how they meet the requirement, including TEFCA participation. There are also optional bonus opportunities, such as reporting to clinical and public health registries, syndromic surveillance, or using TEFCA for public health reporting. In addition to scoring, clinicians must complete the required attestations, including the updated SAFER guides, security risk analysis and management activities, and confirming they are not restricting interoperability and are compliant with ONC review. This table from the MIPS 2026 Promoting Interoperability Quick Start Guide is included as an additional reference supporting eligible clinician requirements, and it reflects the objectives and scoring we covered on the previous slide. Now that we've walked through the 2026 changes and requirements for hospitals and eligible clinicians, let's talk about how KONZA Health can support you in meeting promoting interoperability requirements. Here you will see how KONZA Health helps support your success with promoting interoperability. First, through Health Information Exchange, we support data exchange across all three required options, including exchange under TEFCA. On the public health side, we support things like immunization registry integration, syndromic surveillance, and public health project management. The validation certificates for those measures are provided by the state. From a compliance standpoint, we help support secure information sharing by providing access to data exchange services, which can also help prevent information blocking concerns. In addition to that, our other interoperability tools also support these efforts. Rapid alerts notify providers in real time about patient events, such as admission, discharge, and transfer, which helps improve care coordination. HQ Insights and Quality Measure Optimizer Elite provide analytics and reporting to help track performance and support quality improvement initiatives. MDRO focuses on multi-drug resistant organism alerts, and DAV, or Data Aggregator Validation, confirms that our data can be trusted for quality reporting. Together, these tools support quality improvement, cost measures, and overall workflow efficiency. Our goal is to not only help you meet the requirements, but to make those requirements more manageable and actionable in your day-to-day workflows. If you'd like to learn more about any of these tools, please feel free to reach out to our help desk. For eligible members, KONZA Health supports promoting interoperability by providing certificates of accomplishment. These certificates serve as documentation that specific measures have been met and can also be used as supporting documentation in the event of an audit. This slide outlines the certificates KONZA Health provides to eligible participating sites, so you have a clear understanding of the supporting documentation you'll receive from us. These certificates are delivered by February of 2027 and are intended to serve as validation documentation, helping support audit readiness and confirm that specific measures have been met. For hospitals and FQHCs under the IPPS program, we provide certificates supporting measures like sending electronic referral summaries, bidirectional health information exchange, and participation in TEFCA, as well as documentation related to information blocking requirements. For clinics participating in MIPS or QPP, we support similar measures, including sending electronic referral summaries, bidirectional exchange, and TEFCA participation, along with information blocking attestations. Across all settings, hospitals, FQHCs, and clinics, we also provide certifications for NCQA DAV, which recognizes validated data used for HEDIS and quality reporting. If you have any questions about your eligibility for certificates, please contact our help desk. To wrap things up, we've included several resources to support you as you navigate promoting interoperability. You'll find links here to key guidance from CMS and other government resources, including the final rule, quick start guide, and additional reporting information. We've also included KONZA Health support options. Our help desk is available if you have questions or need assistance. My contact information is listed here as well, so please feel free to reach out directly if you need help walking through requirements or discussing how KONZA Health can support your organization. Thank you so much for your time today. I hope this gave you a helpful overview of the 2026 Promoting Interoperability updates and how KONZA Health can support you. Please feel free to reach out if you have any questions. We're always happy to help.